Bird flu, avian flu. Avian flu is caused by an influenza virus that rarely attacks humans. Several types of avian flu have been detected, including two strains that have recently infected humans, H5N1 and H7N9. When avian flu attacks humans, it can be a death sentence. Avian influenza outbreaks have been detected in Asia, Africa, North America, and parts of Europe. Most people who have developed avian flu symptoms are in close contact with sick birds. In some cases, avian flu is transmitted from one person to another. Since the end of 2015, only isolated cases of the disease have been recorded. Health officials are concerned that a global outbreak could occur if the avian flu virus mutates into a form that is more easily transmitted from one person to another. Scientists are working on vaccines to help protect people from this campaign. Symptoms, signs and symptoms of avian flu may begin within 2 to 7 days of infection, depending on the model. Most cases are similar to those of the common flu, including the following: cough, fever, sore throat, muscles, headache, shortness of breath. Some people may also experience nausea, vomiting, or diarrhea. And, in some cases, this mild infection of the eye, conjunctivitis, is the only sign of the disease. When to see a doctor, please contact your doctor immediately if you have a fever, cough, or body ache and have recently traveled to any part of the world where avian flu is present. Please do not forget to inform your doctor if you have visited all farms or open-air markets. Reasons avian flu occurs naturally in wild waterfowl and especially in poultry such as chickens, turkeys, ducks and geese. The disease is transmitted by contact with infected bird feces or secretions from the nose, mouth or eyes. Open-air markets, where eggs and poultry are sold in crowded and unsanitary conditions, are hot spots, infections, and the disease spreads within the community. Undercooked meat, poultry, or eggs from infected birds to be able to send the campaign. Poultry meat is safe to eat if cooked at an internal temperature of 165 degrees Fahrenheit, 74 degrees Celsius. Eggs should be boiled until the yolks and whites are firm. Risk factors: the biggest risk factor for avian flu appeared to be contact with sick birds or surfaces contaminated with their tongues, saliva, or feces. The human transmission pattern remains mysterious. In very rare cases, avian flu is transmitted from one person to another. If, however, the virus begins to spread more easily among humans, infected birds are most at risk. Complications: people with avian flu may develop life-threatening complications, such as pneumonia, pink eye, conjunctivitis, respiratory failure, kidney function problems. Although avian flu can kill more than half of the people it infects, the number of deaths is low, and that's because so few people get avian flu. In 1997, the World Health Organization reported more than 500 deaths from avian influenza. By contrast, the Centers for Disease Control and Prevention estimates that seasonal flu causes thousands of deaths each year in the United States. Prevention avian flu vaccine: the Food and Drug Administration has approved a vaccine to prevent infection with the H5N1 avian influenza virus strain. This vaccine is not available to the general public, but the U.S. government collects supplies and distributes them in the event of an outbreak. This vaccine can be used in the early stages of such an outbreak to provide limited protection for another vaccine designed to protect against the specific virus causing the outbreak, developed and manufactured in. Scientists will continue to work with other types of avian flu vaccines. Tips for travelers: if you are traveling in Southeast Asia or in an area with a hotbed of avian flu, you may want to consider this option, because the public health recommendations are as follows. Any domesticated poultry should be avoided. If possible, avoid rural areas, small farms, and open markets. Wash your hands. This is one of the easiest and best ways to prevent all kinds of infections. If you're on the go, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Do you have any questions about flu vaccination? Talk to your doctor about getting a flu shot before traveling. This will help you avoid being specific for avian flu, but it can help reduce your risk of getting both avian and human flu viruses at the same time. Poultry and egg products: because heat destroys avian viruses, fresh poultry meat is not a health hazard. And even in this case, it is best to take preventive measures in the use and preparation of poultry that may be infected with salmonella or other harmful bacteria. To avoid cross-contamination, use hot water and soap to wash cutting boards, kitchen utensils, and surfaces that come into contact with raw poultry. Prepare carefully. Cook the chicken until the juice is clear and it reaches a minimum temperature of 165 degrees Fahrenheit, 74 degrees Celsius. Stay away from raw eggs. Since eggshells are often contaminated with bird droppings, try to avoid foods that contain raw or undercooked eggs.